For sure. I've had a lot of extractions, yeah. By the way, I don't call them extractions anymore. I call them amputations.
Amputations.
Yeah,
Yeah.
because extractions are removal of foreign objects, but amputations are removal of your own limbs. I had 8 amputations. I had 4 premolars, 2 upper, 2 lower, and 4 wisdoms.
Yeah, it's crazy how they do that.
Yeah, they're fuckers. The horror
Yeah.
stories I hear, bro, of people and how their life goes sideways when they get their teeth pulled, I really have to do a lot of prayer and meditation and positive thinking just to not fall into a state of mental despair. I'm like a psychiatrist because I hear so much horror stories all the time from people I chat with about how badly their life got disrupted by so-called extractions. It's
Yeah, and all
fucked
these
up, man,
people
that
just
this
trying to make money.
happens.
It's all about the money now.
Yeah. Yeah, it's money, it's money. You can get money for pulling the teeth and then you can do your orthodontic treatment faster with all that space. You can get that straight smile and then get the patient out the door in a year or two, no problem with all that space. So you get paid quicker on that too.
And then on
Higher
to the
per hour
next.
rate. Then on to the next and just, keep the Ferris wheel turning. So what's going on, Aaron? Where are you calling from? What's your age? How can I help you?
I'm calling from Auckland, New Zealand, and I'm 25 years old. So I've had bruxism for a really long time, like since I was, well, got found out when I was 14, but I think it's been going on for a while. I just, I've always had straight teeth, but I think somewhere along the point of my development, I didn't have my tongue on the roof of my mouth anymore. So the jaw didn't really grow, the upper jaw didn't really grow as
Mm-hmm.
big as it should be. And then that might be leading to an uncomfortable bite, leading to bruxism. I'm not too
Mm-hmm.
sure.
Or a small airway leading to bruxism. What's the bruxism like for you? So, some people might not know what that is. It basically means teeth grinding at night. What is that like for you?
So there's muscles here, right?
Mm-hmm.
Whenever I wake up, it's like really tight. Right now, I have Invisalign, so it doesn't really grind my teeth down anymore. But even the Invisalign is like huge grooves for me just clenching down at night. Um,
Before the Invisalign, were you starting to wear away at your teeth?
yeah, my canines are really small. Don't know if
Can we
you can
see
see.
them? Yeah.
And then they're like really sensitive.
Mm-hmm. Do you get headaches?
Yeah, it's starting to get worse. Starting to get tension headaches over here.
Yeah. How old are you?
25.
25. Mm-hmm. So bruxism is your primary complaint.
Um, yeah, bruxism, pretty much.
What's the story with the Invisalign? How did you end up in Invisalign?
Ah, so the orthodontist I went to like 4 years ago was basically the one that my whole family's been to. He just said that I forgot what he said. Oh, because I had a class 3 on my molars, but my canines are a class 1. She's like something something to do with making it bite a bit better. So it's been 4 years now, and he kind of just made it worse. I can't feel my back teeth when I bite. I just feel my front teeth. So
Mm-hmm.
when I'm eating, it's just my front teeth going like that.
Right.
Yeah.
Right.
The question I have for you is because it's been 4 years, and that was about the time when I found your channel as well, 4 years ago. That's when I
Wow.
discovered,
Long-time viewer.
yeah, I that's when I discovered Mewing like 4 years ago as well. I told my mom about it, and she was like, "Oh, nah, just listen to the expert." And yeah, so I just went. I went with this guy. He tried to he tried to tell me that Invisalign can expand the upper jaw, but yeah, it doesn't, right?
Invisalign can move the upper teeth and it can give you more intraoral volume, but it does not expand the upper jaw. It doesn't change the bone.
Yeah.
So whenever you talk about expansion, you have to distinguish between the bone and the teeth. Invisalign can move the upper teeth. It can move them out. It can increase your intermolar width by tipping your upper teeth, but it cannot split your mid-palatal suture or anything like that.
Hmm.
Yeah, basically Invisalign can be used as a tooth-borne expander, but it's not a skeletal expander.
Right.
So did he
And
say, though, that you needed, did the doctor ever suggest that maybe what you needed was some augmentation of your airway, or did he see it strictly as an
yeah,
occlusion
strictly
issue?
occlusal. He's definitely
Yeah.
not an airway focused orthodontist.
Okay, and what do you think is going on here?
I think somewhere along the point of my development, my upper jaw didn't grow as big as my lower jaw. Because they
Yeah,
did notice that my lower jaw is a bit bigger, and my intermolar width is about 37 millimeters.
that's decent. I mean,
Yeah,
it's
it's
not
decent.
it's not tiny. Can you smile real big? Mm-hmm. And can you rotate your head a little bit? Other side, please. And can we see the roof of your mouth? Mm-hmm. Mm-hmm. So are you coming into this call considering some sort of skeletal expansion?
Yeah, yeah. I was wondering if you know any um good orthodontists near New Zealand, like Australia, New Zealand.
Australia for sure. New Zealand, possibly. I can check my list, but in Australia, there's Derek Mahoney.
Oh
And then
yeah.
there's a really good surgeon in Australia named Paul Kociancic. Ever heard
Hmm.
of him?
Nah, I've heard of Derek.
Yeah, Derek is solid. He's been doing MSE for a good while, and he could definitely shoot you straight. And then, you don't really scream to me like a surgical case, but
Hmm.
the long and the short of it is, yeah, there's options in Australia. Do you want me to check my New Zealand list real quick?
Oh yeah,
Or
that'd be great. Thanks.
my list for a New Zealand provider, I should say. Hmm. I'm not seeing anyone in New Zealand initially. Let me just go to the next resource. So I don't see anyone at all in New Zealand.
Hmm.
That's not to say that there isn't anyone in New Zealand. It's just to say that I don't have anyone in my resources that's in New Zealand. How
Yeah.
feasible is it for you to travel to Australia?
Pretty feasible.
What's that like? What's that travel like?
It's not. It's like a 2 hour flight.
That's it?
Yep.
Okay. And is that within the realm of financial possibility for you?
Yeah.
Yeah. If that's the case, man, then it looks like Australia it is for you.
Oh yeah.
Yeah, and so the name I would give you is Derek Mahoney.
All right.
Have you ever heard of Derek? Did I ask you
Yeah,
that?
I've seen his stuff on YouTube.
Yeah. Yeah. Did you know that he was in Australia?
Yeah, I did. I
Hmm.
was just wondering, like, if possible, it might be by any chance in New Zealand, but it's all good.
Yeah, not from what it looks like.
Oh yeah.
The other interesting person you may want to start following on YouTube is Paul Kociancic.
Okay.
That's spelled Coceancicig.
CIG.
Yeah, Coceancig. Kociancic.
All right, sweet.
And he is a very interesting surgeon. He's an orthodontic surgeon. He rebuilds faces, and he's got a book. I forget what it's called, but it's a whole book all about his kind of unique approach to orthodontic surgery. But yeah, he should be on your radar as well, given that you're in that part of the world.
Yeah, because I
Yeah,
noticed I don't really need that much expansion. Like, do you reckon the goal would be like maybe 40 millimeters, 41?
yeah. So let's say, so you said you're at 37 now.
Yeah.
If you did 4 to 6 millimeters, that would put you right in the 42 range.
Hmm.
And then, or 43. And then after a year or two, it might relapse down to 41, 42. So yeah, I would shoot for 4 to 6 millimeters if I were you.
Yeah.
That's always a pretty safe amount of expansion to get. And yeah, once you're in the midst of it, you can sort of make that decision on the fly. And then the orthodontist will also have some input as to how much expansion you actually do, because how much expansion you can do is to some degree governed by what the occlusion is looking like as you expand. So like if the bite starts getting really gnarly due to asymmetry or for some other reason, that means that you probably are going to have to pump the brakes on expansion, but that shouldn't happen in less than 4 to 6 millimeters.
And I have a question about face mask as well.
Sure.
Um, so my jaw, if you have a look, my jaw pops out. Uh,
Oof, that's gnarly, man.
yeah, I don't know how
Jesus.
that happened,
Jesus.
but that might have something to do with the bruxism as well, right? I'd
It
imagine.
could have something to do with the bruxism, sure. That's not a good sign.
Nah, so what? I don't actually know. Like his face mask pulling like the mid face out, and then it's letting that socket go in properly. If you,
It all depends whether or not it's going to let that issue resolve depends on what the nature of that issue is, and I can't really diagnose that from where I'm standing. Has anyone done an X-ray and given you a diagnosis on that TMJ issue?
um, yeah, the dentist that I went to, he did X-ray, but then he's like, oh yeah, chucking the Invisalign, it'll be all good. But I don't know how that's gonna help.
Has the Invisalign helped that issue at all?
Nah, the Invisalign made it worse. Like the whole 4 years I've been doing it, it's
It's gotten
like
worse.
yeah, because like my I can't bite down on my back teeth anymore. Before I could.
Yeah, right. Right.
Yeah, it seems
Yeah,
like
so
that
you're
orthodontist was just trying to sell as many like Invisaligns as he can to make that money.
yeah, he's trying to sell you on a treatment plan and then get your teeth straight and
Yeah,
then
yeah,
hope that you just go away.
yeah.
Yeah, man, that's another question for Derek Mahoney right there. But definitely, I would envision that whatever final product comes out of your treatment, you're going to want their issue to be resolved.
Yeah.
Yeah, that's not natural. That's not the way your jaw is supposed to function. Does it happen only when you consciously try to do it, or does
Yeah,
it happen
yeah.
all the time?
It doesn't affect my life, and it doesn't hurt when I do it. But
Yeah,
it's kind of weird.
it is weird. It's very significant.
Oh yeah,
You can see the air pod almost popping out of your ear when you do it.
yeah,
Fucking crazy.
yeah.
I am not good with TMJ issues just because they're always so unique and
Mm,
they can only really be sort of diagnosed, understood under the lens of a radiograph, which I
yeah.
don't have obviously, and I also don't analyze radiographs. I'm not a doctor, but a good doctor should be able to rebuild your occlusion in such a way that that issue is not occurring.
Okay.
That's one of the goals of treatment. That's sort of a higher level uh, orthodontic goal in any treatment is to minimize or eliminate TMJ issues, certainly not to exacerbate them.
Yeah. So the other question I have is because this orthodontist, he has this sort of guarantee that he would he's gonna fix my bite no matter what. So he's been trying to get the back teeth to touch. I don't know if you can see.
Yeah, there's a little bit of a posterior open bite, sure.
Yeah, so there's like no contact at all. Instead, the contact's up here, the front.
Understood.
Um, should I just go straight to Derek, or should I let this guy fix my bite?
Nah, just go straight to Derek.
Okay,
Yeah, because whatever Derek is going to do is going to shit mix everything.
yeah, because you're gonna have to when you put the MSC in, you're gonna have to get more braces after anyway, right?
Yeah, you're going to have to, and you're going to make a big mess all over again. So even if
Mm,
this guy does fix your bite, sure, some of the good that he will do might carry forward into Derek's plan, but whatever Derek might end up reversing what this guy does.
yeah,
So whenever you switch doctors and you're going into a new treatment plan, the best thing to do is to just cut your losses short as soon as possible and then start fresh,
all right,
without a doubt.
yeah, sweet,
Yeah, and since expansion is your primary goal, then I would just do that sooner rather than later because there's nothing more that this guy can do for you.
Yeah, I don't really want to go back to him anyway.
Yeah, do you have attachments on your teeth from the Invisalign, or is it just
And they
no
just got
attachment?
taken out. They got taken out last week.
Good. So then you're pretty much even right now.
Okay.
You don't really need anything right now. It's not like you have braces on, you have to get them removed. You're pretty much stable. I would
Yeah.
keep the current set of trays in until you see Derek because they'll at least retain any progress that you may have made. I wouldn't take everything out and start relapsing, not until you see Derek. Derek might ask you to do that, but he might not. I'm not sure. What else you got for me, Aaron?
Yeah. So yeah, the orthodontist. I had an appointment with him last week, and then one of his suggestions was to shave down my teeth to get to help fix that tooth problem.
Sure.
Yeah. As soon as I heard that, I was like, "Yeah, fuck this guy."
Yeah, he's trying to just take shortcuts. Yeah, the better approach would be to build up the back teeth rather than to shave down the front teeth. A lot of people do that actually, believe it or not. They build up their back teeth
Oh yeah,
just to,
veneers.
because I don't know if you would call them veneers. I think they just call them build-ups, or even crowns. Like
Hmm.
you would get big tall crowns put on. But that's a super invasive process, man, and I wouldn't resort to that quite yet, but it is a solution. Like what this guy is suggesting, oh, let's just, the contact is being made at the front teeth. Let's just shave them down. That is a kind of logical approach. It's just like you don't, it's a shortcut, and I don't think you're at the point yet where it's time to start pulling those punches and doing stuff like that. I mean, in general, anytime you shave teeth, anytime you drill into teeth, it's a step backward. The better approach would be to extrude the back teeth, or like I said, to build them up.
Hmm.
But that's tricky. That requires orthodontic skill and patience.
Yeah. Yeah. So
So
oh, sorry.
I was going to say your instinct is correct to have a revulsion at the idea of shaving down your front teeth.
Oh yeah. Yeah. So the surgeon that you intro introduced me, was it Paul?
Paul Kociancic.
Yeah. So how would that um benefit would going to him benefit me as well? Going to him and Derek.
Derek knows him, I'm sure. I bet you they're buddies or at least colleagues. Um, I would go see Derek first because I would say you definitely need orthodontics, but you don't definitely need surgery. So logically, the first person you want to speak to is Derek.
Hmm.
And if Derek thinks that you're at all a surgical candidate, I'm sure he'll put you in touch with Paul or someone similar. Yeah, I don't know if you'll even need the help of a surgeon. Maybe, hopefully not.
Hmm.
Hopefully we can get your bruxism to stop and we can get your bite and TMJ issues fixed without any orthodontic surgery. I suspect that probably we will be able to.
So
Yeah,
the
but
surgery,
it's always good to have a surgeon in your back pocket though.
right? And what would the surgeons be doing? Would be double jaw surgery?
It depends, but sure. Yeah, sure for simplicity's sake, just think of the surgeon as being able to be the guy who can provide you with advancement. Or also consider that part of your bite issue is a issue pertaining to the angle of your jaws, and one way to fix that posterior open bite would be to give you counterclockwise rotation of the maxilla. That would be something a surgeon would do. So, for example, right now your bite is like, uh, bear with me.
So
Right now your bite is like this,
yeah.
right? But if you rotate the maxilla surgically, now your bite is flat again. See that?
Hmm. Yeah.
So that's what counterclockwise rotation gives you, is it gives you the ability to have your lower jaw positioned forward without having a posterior open bite.
Hmm. Okay.
But your posterior open bite is so subtle that I would suspect that you could correct that orthodontically somehow.
Mm.
Yeah, I was just going to ask you, what's your breathing like? Do you have any sense as to what your breathing is like?
Oh, yeah, that's right. I was gonna ask you about that. Yeah, I've been breathing through my nose. Yeah, it's all good. But whenever I get a blocked nose, which has been quite recent, quite frequent recently, uh, I do notice I breathe through my mouth at night, causing my tongue to fall back into the airway, and then I just like wake up gasping for air, which is that's sleep apnea, right?
Sleep apnea is a very discrete medical diagnosis, but it's sleep disordered breathing. It might
Okay.
not hit the threshold where the insurance company is willing to call it sleep apnea, but it could definitely be sleep disordered breathing. Yeah, you're struggling to breathe in your sleep for sure.
Hmm.
Do you use a sleep tracker like SnoreLab or anything to monitor
Oh
the
yeah.
amount of snoring? Yeah, what's that tell you? How much are you
Some nights
snoring
it's
a
just
night?
quiet, and then some nights it's pretty loud. It just
Do you
depends if I
know?
have a blocked nose.
Sure.
So
Yeah, like what percentage are you snoring? Do you have any idea generally on average? 25, 30%, something like that?
probably something like that. Yeah.
And what causes your blocked noses?
I have no idea. Like I, because whenever I have that sort of bad sleep from the constant waking up, it seems to exacerbate mucus production in my nose.
Mm,
So like it's like a negative feedback cycle
mm-hmm.
where I'll have more blocked noses leading to worse sleep, leading to more
Yeah.
blocked noses,
Yeah.
more inflammation.
Yeah, maybe just doing an MSE will just pull you out of that by just making your nose bigger, making you a little bit more durable in the face of a little bit of inflammation in your nose. You shouldn't have blockage every time your nose acts up a little bit. You should have a little bit of space there to accommodate a little bit of inflammation before you get blocked.
Yeah, so I wasn't sure if it was a deviated septum problem as well.
Mm, we can just sort of punt on that for now. The important thing to know is that if intranasal issue, like a tissue nasal, soft tissue nasal issue, that would be something you would correct last. That would not be something you correct right now. Right now, you do the MSE, then you see how far that gets you, and then you do any nasal stuff last. Yeah, also, any surgical, maxillary surgical stuff you would do would be before the nasal surgery as well. So we could consider something like that at the very end for you.
Okay.
Yeah, but all of this is tied together with your bruxism. My preferred understanding of bruxism, and I find this to be the case for me, is that when I'm breathing poorly, I'm more likely to clench because, you know, one explanation for why we jut our lower jaw forward and clench it up into our upper jaw, is that we're trying to position our lower jaw forward to open up our airway. It's like our own built-in mandibular advancement device. It just
So
wreaks havoc on the teeth.
we get more air when we sleep.
Yeah, exactly. It's our body's way of moving our lower jaw out of our throat so we can breathe better.
Okay. Yeah, the
So if you
other
can just
reason.
start breathing better, if you can start breathing better, then maybe your body will stop doing that.
Yeah, yeah. And then maybe another reason was heard that every body has a antagonist muscle, like the bicep, tricep for the bicep, hamstrings for the quads. And then I read somewhere that the tongue was the antagonist for the jaw muscles,
Yeah, so
something like
how
that.
would that what would that mean for bruxism?
So the jaw wants to close like that, and then the tongue is kind of acting as the up force. Now I don't know what I'm talking about.
No, it's an interesting thought, you know? Like I know that when I find that I'm clenching my jaws, one thing that I try to do to stop that process is that I try to press my tongue really firmly up onto the roof of my mouth so that I can get that relief of that tension, like I can exert that force into my upper jaw, but without crushing my teeth. Like I let my tongue do the work instead of my jaws.
So it's like a
So
balance, right?
it should be a balance when you're healthy and when everything is in harmony. There should be a balance between the tongue pressing up on the roof of the mouth, the teeth maybe making a very light contact. It shouldn't be a clench unless you're chewing. And then there should be clear open nasal breathing at all times. That's the norm.
Yeah, so definitely the MSC will help then, because even with a 37 millimeter molar width, it still kind of clams the tongue. Yeah.
Yeah.
How big is your intermolar width?
So it's complicated, but right now it's probably at around 42, maybe even 41. I've done so much tipping of my upper teeth in that my intermolar width has actually gone down, even though my skeletal base has remained pretty much at full expansion that the MSE gave it. So because MSE expanded especially my left side so far, I had to really tip the teeth in on that side to get a bite back here.
Uh,
See how this side is really torqued in as compared to this side, which is a little more upright. So by torquing in this side, it actually reduced my intermolar width significantly. But the skeleton holding the teeth is still very wide, and so my nasal breathing is still at full strength that I had at the peak of my MSE expansion and at the peak of my dental intermolar width. So, yeah, but for all intents and purposes, low 40s. At one point, it was mid 40s.
so you can get your whole tongue like right up there.
I can't really, no. I mean, I still get scalloping in my tongue.
Oh, really?
I mean, right now I have lingual braces, and I have had them for about a year, so it's hard for me to really know how much oral volume I really have, just because I have so much damn metal on the inside of my upper teeth and lower teeth. Uh, but yeah, no, I mean, look, I'm not perfect, not by any means. I could use more, especially in the AP direction, front back. I would love to have some more space up front for my tongue. I get a lot of scalloping up front.
Oh, yeah. Because you've had extractions.
For sure. I've had a lot of extractions, yeah. By the way, I don't call them extractions anymore. I call them amputations.
Amputations.
Yeah,
Yeah.
because extractions are removal of foreign objects, but amputations are removal of your own limbs. I had 8 amputations. I had 4 premolars, 2 upper, 2 lower, and 4 wisdoms.
Yeah, it's crazy how they do that.
Yeah, they're fuckers. The horror
Yeah.
stories I hear, bro, of people and how their life goes sideways when they get their teeth pulled, I really have to do a lot of prayer and meditation and positive thinking just to not get, to fall into a state of mental despair. I'm like a psychiatrist because I hear so much horror stories all the time from people I chat with about how badly their life got disrupted by so-called extractions. It's
Yeah, and all
fucked
these
up, man,
people
that
just
this
trying to make money.
happens.
It's all about the money now.
Yeah. Yeah, it's money, it's money. You can get money for pulling the teeth, and then you can do your orthodontic treatment faster with all that space. You can get that straight smile and then get the patient out the door in a year or two, no problem with all that space. So you get paid quicker on that too.
And then on
Higher
to the
per hour
next.
rate. Then on to the next and just, keep the Ferris wheel turning.
Yeah, I noticed my brother, they really like stuffed him up, eh? Because he was breastfed for like 3 years.
No shit.
Yeah, my little brother. And I noticed like, damn, he's got a pretty nice face. Yeah, even when I was like pretty young, he's 7 years younger than me. And then he had a bit of crowding when he's grown up, his new adult teeth was coming a bit crowded for some reason. And then I'm actually not sure what they did to him, but after orthodontics, he just he didn't look the same. Like even his
Yeah.
teachers were like, he looks real different.
Fuck, man, that's terrible. You didn't know at the time you couldn't save him?
Nah, I only found out about this 4 years ago.
Fuck.
No way. But even then, I told my mum. I was like, "Oh, I've been researching this new topic," and then she's just like, "Oh, if this is correct, all the orthodontists would be doing it." But that's interesting, eh? Like how only some orthodontists are airway focused, but most of them are teeth focused. Get that smile.
Yeah, it's definitely not inherent to orthodontics to be airway focused. They don't teach that in school.
Yeah. So the ones that do end up being airway focused, they're more like they just came across it themselves, I guess.
It's hard to say. I mean, it's probably different in every case, but there are ones that either have common sense or they were patients themselves or they had a few bad patients that had extractions that came back and splashed cold water in their face and were like, hey, bro, look what you did. Or they went to a seminar and they got told that they could make more money by offering some airway treatment. Who knows what it is, but it is a tiny percentage of orthodontists that are airway focused. Tiny percentage. It's actually far more common for a general dentist to be offering airway treatments than it is for an orthodontist.
I guess
General
because they,
dentists have sort of taken more ownership of this space than orthodontists have, but the problem is those those sons of bitches end up just pushing tooth-borne expanders because that's all they're really qualified to
yeah,
use. And
I went.
that's counterproductive.
You had a tooth-borne expander, right? 4 years ago.
Several of them, yeah.
Several. I don't know. I got the same one you had. I forgot what it's called.
It's like a sagittal expander.
Oh, what does that mean?
It's basically like an acrylic expander that has metal wires in it, and you turn the screw, and it gets a little wider each time you turn it.
Yeah, yeah, yeah. So I was
It
doing that.
removable, right?
Yeah, removable.
Yeah.
I saw you got that, and then I just went out and got one myself.
Oh fuck, man! Really? You've
Yeah,
been following me for that long?
yeah, I have.
Jesus, bro. Someone like me on the internet, you gotta like, there's a 2 year lag. Treat,
Yeah.
whatever their current idea is, wait 2 years before you try it.
Nah,
Like I,
I
I
pre.
started, I started talking about MSC 2 years ago. Like at that time, it would have been a bad idea for you to dive right into MSC, but now 2 years later, it's like sort of safe. We at least know where the dangers are. We can try to avoid them.
Yeah, there's been cases that you can look back on now.
Yeah, yeah, exactly.
Yeah. Yeah, maybe it was a good thing I had this treatment 4 years ago because I was trying to do what I was willing to do whatever to stop the bruxism.
Well, bro, you seem stable enough. I mean, like, you're definitely healthy enough to try something else. It's not like you did a treatment that fucked you up so bad that you can't do anything else. So that happens with a lot of people. People who do AGGA, if they have a real bad experience with it, they can fuck up their teeth so bad that they can't even do anything else. So just thank God you didn't do AGGA. You're lucky that you did the sagittal expander instead of the AGGA because the AGGA is the real nightmare. And there's a lot of
Yeah.
people in your part of the world doing the AGGA.
Oh, really?
Yeah, man, there's that lady Anne Marie Cole in Australia. She's like the top dog for AGGA.
AGGA is just
She
really pushing your teeth out. That's it, right?
it's pushing the front teeth forward. So it concentrates its harm on the four upper front teeth, maybe the six upper front teeth, but primarily the four upper front teeth. And they get taken for a ride several millimeters forward. You get these big spaces between those teeth and the teeth behind them. You think that your maxillary bone is growing to have this space in it. think your maxilla is getting bigger, but really all that you're doing is you're just moving the upper teeth forward into what? Into no man's land. And then they end up with no bone support, with root resorption, gum resorption, and then you're just like, oh fuck.
Oh, so the lie is that it can bring your maxilla forward. That's what its advertised as.
The lie is that it's growing your maxilla forward when in reality it's pushing your upper front teeth forward.
Right.
Yeah, it's really nefarious because they use all this language about, what are they? What's the term that they use? Epigenetic bone remodeling or epigenetic bone growth.
Oh, yeah, the fancy
They
words.
like, yeah, fancy words that appeal to people who are into holistic health. Oh, my body does have a natural mechanism for expanding. I just got to put this little device, this $20,000 device in that presses this little button at the roof of my mouth, and then all of a sudden, voila, my maxilla grows. It's a really sexy idea. Unfortunately, it's complete fucking rubbish.
Honestly, I feel like there's a lot of complete rubbish that they tell you out there.
For sure, brother. For sure. 90% of it.
Yeah. I don't know if you read about like seed oils and shit.
Seed oils, yeah, I'm all over it. I'm a
Oh yeah.
carnivore guy.
Oh yeah.
Yeah. I don't really fuck with seed oils.
Yeah, same. It's so hard though if you want to like go out and socialize and stuff. They cook everything in that.
If you can get your body strong enough by having a really great diet when you're at home, then you can tolerate a little bit of that when you go out occasionally. You basically build up a reservoir of well-being, and then you can go out and abuse it a little bit on, the
Oh, yeah.
occasional weekend with, something moderately healthy. Something, or I should say something less unhealthy. I don't think it's the end of the world if, like, you go to Chipotle and, you get some beef that was cooked in some oil. It's better than getting cake, right? Or like a fucking candy apple or something like that. That's just all sugar. So there's degrees of harm when it comes to food. But yeah, the best thing to do is to just like cook your own meat at home.
Yeah, that's what I've been doing.
Yeah, that's good. That's good. By the way, are you from the same place that Heath Ledger is from? Is Heath Ledger from New
Heath
Zealand?
Ledger. I don't know who that is.
Oh, really?
Nah, who is
Damn,
he?
bro, are you too young for Heath Ledger? Oh man, that's crazy. I don't know.
Maybe.
He's a famous actor. He was the Joker in Batman.
Oh, that guy.
Yeah, you sound exactly like him. That's why I'm wondering if he's from where you're
Oh,
from.
he's from Australia.
Oh, he is? Okay.
Yeah.
You guys sound exactly alike.
No, we do, yeah. It's kind of similar.
It's cool. I feel like I'm talking to Heath Ledger.
Oh, yeah.
Yeah, bro, if you came to America with your accent, you would fucking crush it.
Oh.
You would
That's how it
fucking
is with Americans here. They all love the Americans here.
What? American
Yeah.
accents are so basic.
Oh, yeah. Maybe because you guys hear it all the time.
Could be.
But I hear we hardly hear it.
Yeah, no kidding. Yeah, but if you came to Boston with your accent, bro, all the ladies would swarm around you.
Nah, bro,
Dead
nah.
ass. Dead ass, I swear. Yeah, so what else you want to talk about? We've had a good go at it so far. So what's your plan? I mean, are you gonna make an appointment? Are you gonna are you
Yeah, the
gonna
plan
fly to
is,
Australia?
yeah, get an appointment with Derek, and then he'll probably get me with an MSc. Um, expand the upper jaw. But yeah, this is my
Hmm.
other question. Is my lower teeth, is it like tipping?
They they look okay, man. They look either like they're tipping in a little bit or they're upright. I don't look like Doesn't look like they're tipping out too
Oh yeah, yeah,
much.
that's my question. It's like kind of tipping in, eh?
Yeah, yeah, maybe a little
Oh,
bit. Some of them
so
at
that means
least.
if
I don't
I,
know about the molars, but
so that means when I expand the upper, it should be all good. I don't really have to expand the lower.
yeah, you might have a little bit of juice there to play around with.
Oh,
Get
yo.
you an extra couple millimeters. Yeah, I don't think you have to worry about like needing a lower jaw surgery if you want to go for that 5 millimeters of upper jaw expansion with the MSC. I think you can squeeze that out of the lower teeth based on what I just saw.
Oh, sweet.
Most people can, bro. That's the way that 99% of MSC cases go down.
Most of the cases is that the upper jaw just doesn't grow properly.
You mean like why do people need MSC in the first place?
Yeah.
Yeah, bro, because we have an epidemic of underdeveloped faces.
Yeah.
Yeah, we live in a clown world where everyone's all sick and unhealthy.
Yeah. That's what urbanization does, I guess.
That's what
Cause like
urbanization.
yeah,
Well,
cause
it
it's
does
crazy.
no,
Cause
it
like I think 98% of the history of humans we just lived on farms, and then a small percentages were in cities and shit.
yeah. Well, if you want to include pre-industrial, or I should say pre-agricultural, then we definitely weren't living on farms. We were sort of roaming around in tribes in, more wild habitats, not agricultural sort of man-made habitats like farms. But um, I would say the largest percentage of human history we were doing that, which is that's the era where we would have had the biggest jaws, was when we were hunter gatherers,
Hunter
you know.
gatherers.
Um, but urbanization, look, nothing has to be any particular way. If we had public health initiatives that promoted good craniofacial habits, we could pack 7 million people into New York City and they would all have good facial structure. We're not promoting the right ideas and habits for people to have good facial structure. I mean, first and foremost, we're denouncing breastfeeding as something that's oppressive to women, okay? And I understand in many cases if women can't breastfeed. I totally understand and get that. But there is also a cultural push. It's part of feminism to denounce breastfeeding as, something that's beneath women, right? That's a step backward for the development of children's faces. Then we have this soft food craze. Everyone is so just excited to get their baby eating pureed shit, mush. Everyone wants to get, oh, my baby had his first pureed blueberries today. Instead of getting the baby off of the nipple and onto something a little bit harder for them to actually chew on and develop their jaws, right? That's another really bad public health initiative that's out there. And then it only goes downhill from there. Everyone's getting dogs and cats now. Kids, oh, let's get a dog so little Jimmy can grow up with a dog, right? And then little Jimmy has freaking allergies for the first 8 years of his life, and he grows up a mouth breather because he can't breathe through his nose. Then little Jimmy ends up 7 years old, and he goes to the orthodontist. He's got crooked teeth, and then Dr. Bozo the Clown, who's got to make the payment on his AMG Mercedes in his fucking vacation house in Martha's Vineyard, needs to just, get Jimmy in and out because he's got to have, 40 Jimmys a day in order for him to make his house and car payments and keep stacking stacks. So what's he do? Oh, little Jimmy, we can get your teeth straight. Let's just yank out 8 teeth. We'll just amputate 8 of your teeth. That'll give us space to straighten you out. You'll be in and out of treatment with me in a year and a half. Doesn't that sound perfect? Year and a half, $10,000. You can have a perfectly straight smile. And that's how our healthcare system works. And then after little Jimmy gets those 8 teeth yanked, he gets even worse. Then he gets ADD. They throw him on Adderall. Then he becomes antisocial. They throw him on fucking Xanax and fucking Prozac. And they get him an iPhone so he can fucking pass his time on TikTok instead of instead of being miserable and suicidal, he can just be on TikTok and numb his life away through that. You know, and then if he's lucky, he's smart. He probably is smart. And he does some Googling, and he comes onto YouTube. He decides to take advantage of the resources he has available to him. He comes upon jaw hacks. He figures it out. And then he books a consultation with Ron. Ron tells him about the local MSE provider, the local orthodontic surgeon, tells him about mewing, tells him about how he should be doing kettlebells every day and eating more steak, fucking chewing gum, spitting game to girls, developing his social skills, working toward a good career so he can have money in the bank. And then he, expands his jaws a little bit, gets his life in order, takes a step toward being a good man. A healed, responsible, healthy man who's not just coping, but who actually might thrive a little bit. No one's going to be perfect, but at least he's surviving. Right? And that it didn't have to be like that. He should have never had to talk to me. He should have just grown up with a normal face, had a good, healthy upbringing, been a Chad, played some sports, probably not football, because football is destructive to the brain. Maybe baseball, maybe basketball, maybe, volleyball, whatever. Something that gets him developing his hand-eye coordination, gets him on a team, doing teamwork, developing social skills, using his body in competition with other men, da-da-da-da. And he should have been normal. But it's not because he was living in the city this all happened. It's not about urbanization. It's about bad ideas from the top down. And then we have better ideas coming from the ground up through things like my YouTube channel and similar. But this is really a failure of public health, is what it is more than anything. Is it a concerted effort to weaken young men so that they become more docile? I don't know. Certainly, if you connect the dots looking backwards, that's what it appears to be. Right? Like, you could not design a more perfect sabotaging of young men's health, wealth, and happiness if you tried. It's also perfectly orchestrated. Every possible bear trap is put in front of young men and women, but young men are the ones I sort of specialize in and I talk to. My channel is 90% men or more. So it's a dark time we're living through, but we're going to get through it. We're all going to make it. All of us. We're all going to make it. We're not going to be perfect, but we're all going to make it. We're all going to be better than we could have been if we didn't put in the effort to try to climb out of this hole.
Yeah. You probably heard the quote, if you want to destroy a nation, you destroy the men first. Something like that.
Yeah, makes sense to me. Why fight a war? Why fight a physical war when you could just, plant some initiatives and then cause self-destruction? Self-destruction is better than you destructing. First of all, because then you don't get blamed for it. Second of all, because you save money on weapons and military affairs and, a resistance. And third, because what if you can destroy and get rich off of the destruction?
That's perfect.
It's a perfectly evil plan.
Yeah. From the top down, eh?
Maybe, bro. I don't know. Look, I'm just hypothesizing.
Yeah,
We're just.
Nah, I've thought about the same thing exactly like you. There's so much shit that they tell you. Like, for example, saturated fats cause heart disease. And then from a young age, they also tell you, like, oh, watching porn is good for you. Go jack off.
Yeah, right.
What the fuck? Like, when in history has there ever been high-speed bitches? High-speed videos and images of bitches that you can access anytime?
Never.
Never. But they're like, oh, yeah, go ahead.
Yeah, no, it's crazy, bro. Porn is a weapon.
Nah, yeah.
Porn, when a young man gets fixated on porn and gets fixated on scratching the itch in his cock because he's like horny all the time because his mind has been corrupted by lust from pornographic images, he loses his ability to think. And when you can't think, you can't figure this all out because it's actually a pretty complicated scheme, right? Like you and I, you're a really smart guy and you're a lot younger than me. I'm older than you. I have more experience. I mean, I don't have it figured out, but like I'm sort of onto it, and so are you, even though you're much younger. But it's not easy to figure it out, bro. Like it takes work.
Nah,
It
it's
takes
so hard,
work.
man. Like, because when you're in it, like, it really takes outside intervention to really pull you out, kind of thing.
Yeah,
When you're in that cycle,
it does.
yeah,
Like let's say you're a porn addict or a cannabis addict. Cannabis is a really bad one now too. You could even know that you have a problem, but you're powerless to do anything about it because your biochemistry has been hijacked by the addiction. Like you have this first order idea that I wish I wasn't watching porn, but then there's this higher order emotion that you're feeling, which is that I can't be comfortable unless I just watch it right now, and that's gonna win out every time. And so guys get stuck. They get stuck in these loops of self-destruction with all this temptation dangling around them. Cannabis, porn, fucking the death scroll of Instagram or TikTok. Whatever it is, sugar. Sugar's another bad one, man. Sugar will fuck your day up. And if you fuck your day up enough days in a row, now you've had a fucked up week. If you fuck up enough weeks in a row, now you've had a fucked up month. If you fuck up enough months in a row, now you've had a bad year. If you've had a bad year, now your life is just on a different course. And that can just happen, bro, from having a bad high carbohydrate diet where you're constantly like eating, getting like a 15-minute euphoria from the taste of the food, and then next thing you know, you need a nap.
yeah.
That's bad too, bro.
The thing I understand about sugar is like the only place you'll naturally find something sweet is either honey or fruit. Like, that's the only place you'll find something sweet because of the high nutrients in honey and fruit. It's incentivized
Right,
by nature to eat that stuff. Then now you got
right.
companies, right, hijacking that sort of natural desire and then just putting sugar in all their fucking carbohydrates and shit. And then everyone's all like, ah,
Yeah, everyone's all riding the roller coaster of the blood sugar. Yeah, well, people don't realize that processed carbohydrates in the form of a loaf of bread or a fucking cupcake or whatever, um, that's metabolizing similarly, not exactly, but similarly to when you eat table sugar. It's a form of it's a kind of sugar,
the
and it's
carbohydrates
yeah, like
because
like
it's so
like
refined, is
bread.
it?
Well, it's just inherent to the food item itself. It's not a protein or a fat. It's a carbohydrate like sugar. It's a kind of sugar. I don't know if it's fructose or glucose or whatever the sugar is in bread. I don't know exactly. I'm not a chemist, but it's gonna jack up your blood sugar like fucking crazy when you eat bread.
Yeah.
So yeah,
And then
you're
the
right.
more you
Bread's
jack up
not
your
a
blood
natural
sugar,
food.
yeah,
The more you jack up your blood sugar, the more it's got to jack down. The higher the whatever goes up must come down.
yeah. And then you got an epidemic of insulin resistance.
Then you get diabetes and da 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 da. But I'm not really concerned with that for young men. I'm more concerned with their energy levels because like a sugar high and then crash is very similar to jacking off to porn. Like in terms of what you experience in your body. When you jack off to porn, you turn on the fucking porn and then you're all jacked up. You're excited. Oh my god, look at all these beautiful women out there in the world. Oh my god, I'm gonna go out and get them. And then you coom, and then it's just like, and then it's a low, and then you sink below baseline for a while. It's kind of like when 30 minutes after you eat sugar, you crash and fucking burn. It's not
Prolactin
a
levels
it's
go up.
whatever it is, it's a biochemical storm and not in a good way. You want to get good biochemical storms. You know, you want to get adrenaline and fucking dopamine and all the catecholamines. You want to cold plunge and work out and sleep good and then have good social experiences that make you feel natural highs. You don't want to feel these crashes from all of these exogenous, intense drugs.
Synthetic highs.
Yeah, what's that? Say that again.
Oh, is it synthetic highs?
Yeah, what's that mean?
Synthetic, like
Oh,
artificial.
synthetic highs. Yes, synthetic highs, exactly. You don't want synthetic highs ever. You want to earn your highs.
Yeah, for sure.
But just to bring it full circle, no matter how hard you're working to live a perfect, virtuous life, if your facial structure is too small, you're capped. And that's why a guy like you needs to just get some artificial dental intervention just to give you an opportunity to kind of live a normal physical life.
Yeah, the main thing for me is the sleep. Like sleep is just, I feel like it's the foundation of everything. If I can't get a good sleep, then my whole day is shit. Everything is
Yeah,
just shit.
facts. You're right. Sleep is huge. Sleep is everything. Sleep is everything. And that's, here I am, man. That's the crux of my channel, is to help guys with this particular problem, the airway problem, so they can sleep better, they can feel better, and they can get on that upward spiral of health and well-being. And if they end up looking a little better on the other side of it, that's great. But, I was always more concerned with the health aspects of jaw expansion as opposed to the aesthetic benefits of jaw expansion, because the aesthetics are a crapshoot. MSE, sometimes you look better, sometimes you look worse. You never really know.
Yeah.
But it's always good to be able to sleep better. What else, bro? You got anything else for me?
The what you were saying about the highs that you earn,
Yes.
yeah, that for sure is definitely the best. But like I realize like there's also shit that can happen to you that you got no control over, and then that can just fuck you. Like for example, I was oh yeah, I got into a big accident, dislocated my shoulder, fucked my ankle, and after that you just locked in your room for like 2 months.
Yeah, man.
It's not fun.
Look, when we get sick and when tragic things happen to us in our lives, all of the worldly bullshit that we hear about, all the Instagram aspirations and all the influencers and all the dreams we hear about of striving to be successful this and sexy that, it all means shit. When we get hit with reality like that and with tragedy and with sickness, that's when we need to go real deep into the wisdom traditions, and that's when we arrive at religion. That's where Christianity comes in, or some core spiritual tradition that teaches you that you can be happy and that you can have hope even if you're a triple amputee, right? Like, that's when you dig deep and you have to find God and you have to take refuge in God. No, really. I was just sick last week. Remember, I had to
Yeah,
reschedule our
oh yeah.
chat. Remember?
Yeah.
I was fucked up, bro. And I fasted for 90 hours and because I was so sick. And pretty much the whole time I just prayed and I just counted my blessings, and all I asked God for was to just have a chance to be healthy again. And all the other bullshit meant nothing, bro. Money and status and the YouTube channel and my job. All I cared about was how lucky I was to have, my girl and my family and my friends, and then my health. And I knew that even if I died, it's like, you know what? Maybe I'm dying. Who knows? I knew I wasn't, but when you're sick, it really feels like you're dying. Your body is failing you. And I was just like, what's left in the midst of this? Well, what's left is God. God still cares about you even when you're miserable. God is still there when you're miserable. And so sickness and tragedy, like what happened to you, is really a golden opportunity to get to know your creator.
No, I laughed because that's exactly what I did. I was like,
Oh,
fuck, this
really?
is so shit.
Yeah. Hmm.
Yeah. And then I just started reading the Bible. I was like, right. And then yeah, it was just starting to make sense. Because the crazy thing is I was like, there's so many religions, right? How do you know which one's real? Like
Sure.
like if you're born in a Muslim family, probably be Muslim. Buddhist family, probably be Buddhist. Like Hinduism. You said you were Buddhist for a while, right?
Yeah, I was.
So do you know why you switched to Christianity?
Christianity for me right now is doing a much better job at explaining the world.
Oh yeah. In what way?
But, uh, if you read the Gospel of John, you can see that the fundamental struggle Jesus has is that he's trying to speak truth to power, and he's trying to talk about the good, and he's trying to reform the way that the Hebrews are living. Like he came to preach to the Jews, and he comes down and he's like, look, what we're doing is all fucked up. We got to fix this. This is wrong. And then he gets rejected and he gets killed because he's speaking the truth and because no one wants to change and start living better. And so you see that the good is killed by the force which rejects the good. And you see that same drama playing out in our world today. You see the message of Christ, whenever it gets put out in public, gets crushed, and it gets, ridiculed in a million different ways. And it's like the same struggle that Jesus had in the Gospel of John is still playing out 2,000 years later. And it's amazing. It's amazing how pertinent and how relevant the Bible, especially, I haven't read a lot of the Bible, but one of the things I did when I was sick was I listened to the Gospel of John King James version on YouTube. And it's just like, I felt like I was reading a story that could have been written last week, you know? And this promise that as long as we stick to the truth, as long as we respect the truth, and as long as we're not afraid to speak the truth, even though it's unpopular and even though it gets us in trouble with the authorities, God blesses us for being warriors for the truth. That's an inspiring message, and that's what we need more of, because everyone is so afraid to speak truth to power right now.
Yeah, that's crazy because like the the more truth you speak, I guess, the higher chance you're gonna get crushed, right? Because that's exactly what happened.
Yeah, with Christ, you mean?
Yeah,
Yeah, yeah. They murked him, man. They flogged him, and then they crucified him. And
yeah,
all he really did was like speak the truth. All he was like was just like, we have to live better. We have to follow these moral rules. We can't. He would say live in sin, but we can't, you know, live this corrupt way as a society, as a people. We have to live better according to God's natural law. And that idea killed him.
it's like kind of like what's happening to the homie Mike Mew.
In a way, sure. In a way, it is.
Yeah,
Definitely, there's definitely a parallel there.
yeah, damn, bro, that is crazy. Yeah, there's a lot of parallels.
There's a lot of parallels. The gospel is as fresh now as it ever was. And I think a big problem that we have in our world in terms of mental health and in terms of how fall how far the world has fallen is that people just don't read the Bible anymore. So no one has this historical perspective and this spiritual perspective on the dramas that are happening in the world between good and evil. People are told that the Bible is this weird, uh, you know, weird book of stories that were written by men. It's not the word of God. It's just men who wrote it, dozens of years after it actually happened. And then a bunch of other, you know, privileged white men assembled those books at the Council of Nicaea and whatever in 350 or whatever, and decided, and then they built a religion so that they could control people. And there's all this sort of critical race theory around the history of the Bible and where the Bible comes from. And all of that negativity gets people to think the Bible is a waste of time. And truthfully, the Bible can be a little bit inaccessible and boring if you're just opening it up, especially if you read the wrong version. Because remember, there's all sorts of different versions of the Bible, and a lot of them are like subverted, and they're written in a way that doesn't give you the whole truth. So you got to have the good versions, and one of the good versions is the King James Bible. It's written in a kind of Old English that hits with a punch. It hits good. And like I said, I haven't even read most of the Bible, but I have been reading the Gospel of John, and it does pack a punch, and it is very, very relevant, very fresh. I think if more people read that, they would be like, oh, fuck, this is what's happening in the world.
Mm. So you reckon the King James version is a good read?
King James is a solid version. My brother put me onto that.
Oh, yeah.
And he knows what he's talking about. He's pretty much a scholar when it comes to Christianity.
Oh, okay. Now, I realize that, like you said, you can't really like have your hope in the world because whatever's in the world can be taken away anytime,
For sure.
and it's going to be taken away eventually anyway when we die, right?
We know that. Yeah, that's an inevitability.
But another thing I realize is crazy. Like I always forget I'm gonna die. Like I wake up, go for my morning piss, and I feel like that's gonna be like that forever. Are you gonna wake up and go do your morning piss, go brush your teeth, eat your breakfast? But then when I really meditate on the fact that I'm gonna die, it's crazy.
Yeah, it is crazy. It goes by so fast too, man. I mean, you're gonna close your eyes, wake up, you're gonna be 33 like me, or 32. Honestly, I forget what I am. 32. Yeah, eventually it goes so fast you lose track of how old you are. I think I'm
Yeah,
32. And for real, bro. And you could go much sooner than like you think you've probably figured, oh, I'll live to at least 80, right? You don't know
yeah,
that. You don't know that, bro. Tragedy falls on people all the time.
yeah. And die tomorrow.
Could die tomorrow. It's fleeting. It's fleeting, and nothing makes that more apparent than when you get sick, like I was
Yeah,
last week. When you're sick, bro, and your body can't make happy chemicals, and you can't even enjoy food, you can't even sleep without you can't even close your eyes without having these feverish nightmares, weird, bizarre dreams because your brain's all fucked up because your temperature's 102 or whatever. You're just like, wow, man, I'm delicate. I'm delicate, and so much of the worldly stuff just falls away.
yeah. That's when reality hits.
It's a good experience, but you have to approach it with the right attitude, and you have to, because what most people do when they get sick is they take a bunch of medicine, they take codeine, you know, they they watch Netflix, they watch a whole season of some bullshit show. But what you really should do is you should be present with it, and you should pray your way through it as a way of finding peace. Use the sickness as like um a compass to guide you toward peace. You just follow your inner sensations and keep praying and keep making appeals to God until you feel better inside, and then you know you've struck a nerve with God. What else, bro?
So how long have you been, would you say you've been a Christian longer than you were a Buddhist?
I mean, I was born a Christian, but no, I mean, my interest in Christianity has been on and off for the last several years. So I would say it's even. But as the world keeps turning and as current events keep unfolding, it deepens my Christianity to see it all go down.
And
Yeah. Geopolitics and the culture wars are just reinforcing my Christianity.
yeah, because you said that Christianity explains the world better, right? Yeah. At some point, I was leaning towards Buddhism and Hinduism because it kind of explained the fact why bad shit happens to people through karma, right, from your last life.
Yeah.
So that explained that, but Christianity definitely doesn't explain that. It's more like um, you kind of suffer, and that suffering you're gonna suffer, and God is in control of that suffering, but you're still gonna suffer anyway. He may or may not take it away. But I guess the goal of that might be to power through the struggle.
As a Christian,
I don't know. Yeah, through life.
yeah, I think that the goal is to take refuge in God and just the act of putting your struggle in God consciously by deciding, okay, I'm gonna put this burden on God. That by itself takes the edge off. And then at the same time, it's okay to take steps in your everyday life to make your situation better. That's okay. Like God wants you to be self-improving. God wants you to lift weights. God wants you to exercise and eat healthy.
Oh,
God doesn't want you to just wear rags and be a beggar and
yeah.
and suffer needlessly. God wants you to do your best, but also it's okay if it's not perfect and if you're still suffering, and you can put that burden on God.
So it's just all about doing your best with what you got at the moment.
Of course, what else can you do? And you have to
Yeah.
accept the fact that it's not going to be pure bliss. Life is not Skittles and pizza. Life is full of difficulty and it's full of struggle, and some of the struggle you wouldn't believe, and it's hard to accept it, but accepting the fact that the hand you've been dealt is just as mixed and fucked up as a lot of other people. It's an important realization because we all think we're special. We all think, oh, you know, I'm better off than other people. But at the end of the day, our tragedies are often no better. I mean, when I think of my extractions and when I think of my headache conditions and when I think of some of the misfortunes I've had with my career and my work, some of the, you know, the bad social connections I've made that have taken me down false paths in terms of lifestyle choices, pot smoking and drinking and fornication and all that. Yeah, I could make a pity party for myself. But like, yeah, in a way I have had a really rough fucking go at it. Like I've had a lot of bad shit happen to me that didn't happen to a lot of people that are successful, handsome, beautiful, healthy millionaires right now. But I can't compare myself to other people and be like, "Oh, why am I not a Chad? Why am I not 32 teeth, big giant airway, slaying bitches on, in my travel Instagram profile where everyone glorifies me and is jealous of my travel lifestyle, you know, and driving a fucking Bugatti or whatever. It's like I'm dealt the hand that I'm dealt, and accepting how shitty your life is sometimes is a good place to start. As long as you realize though that's part of the essence of Christianity, is realizing that that's kind of just the nature of life. And then the other key is remaining sober through it all. You can't drown away the pain with drugs. That's cheating, and it doesn't lead anywhere good long term. You got to face it sober, and you have to let the experience pass through you sober, and you have to learn from that. That's spiritual growth. Getting high and having some fucking pseudo moment of clarity when you're stoned is that's not spiritual growth. That's just doing evil. That's taking the evil path that the evil powers that be want you to take. They want you to respond to your pain by going to the dispensary and buying a joint and fucking getting high. That's not Christianity. Christianity is feeling the burn and learning from it. Taking refuge in God and becoming stronger, becoming more durable in the face of that difficulty by getting used to it till you're tough as nails. Then you're a real man.
So yeah, not taking the easy way out.
Yeah, the easy way is smoking and scrolling and porn and all that. That's the easy way to deal with difficult feelings. Are you happy with the chat? Did you get what you wanted out of it?
Yeah. Got the doctor, MSc information. Yeah, I think I know where to go from here.
All right, bro. I really enjoyed chatting. All right, bro. I wish you the best, and keep in touch and let me know what else I can do to help you.
All right, cheers.
All right, bro. Cheers.
Take care, bro.
You too, man.